All right, guys, I know it's late, but we're going to do this. And I know that you'll get a lot of information from this webinar tonight. I hope there's a lot of questions at the end. I don't have anything to do after this, so ask away. Now, I think it's safe to say that for the most part, most of the attendees on this webinar do not have a digital scanner. So I have 45 minutes to answer the burning question. And that question is, why do I need to go digital? Hey, I have traditional impression materials. I've been using them for years. I'm not having any problems with my impressions. My crowns are great, no remakes. My staff and I have a good workflow with traditional impression materials. So why do I need to go digital? Just to let you know, I'm a general dentist, practice 9 to 5, Monday through Friday. Nothing special, just regular office, seeing regular patients, doing regular stuff. Root canals, crown and bridge, fillings, prophies, doesn't matter. Nothing spectacular. And so I'm going to kind of take you through my journey of going digital and give you some reasons why you should. First, the hype. Listen, I know everybody's heard the hype. You got to go digital. You got to go digital. The facts are the number of digital impressions that are made are going up every month. Now, part of that is because people who have digital scanners are scanning more. That's driving the numbers up. But also, people are buying scanners and getting into digital impressions. So these numbers are going to continue to go up. The main or primary use for these scanners are going to be aligners and crown and bridge impressions, along with digital dentures and partials. Secondary uses for scanners can be night guards and whitening trays, but another one is patient records. For the most part, when you have new patients come in or patients coming back and for their recall and you have to take x-rays, typically doctors use the scan as a part of that particular visit. You're doing heart charting all over again, you're doing x-rays, you're maybe doing perio probing. And so along with that comes a full mouth scan. And what that does is gives you a baseline of where those patients are, especially the new patients, where they are, what type of condition that their mouths are in or their restorations are in, and then pointing out the areas that are their concerns or your concerns. It allows you to bring the patients into that conversation. The studies of digital impressions have shown that, hey, these preps are modified to a point where we can see everything that we've prepped from a crown bridge standpoint. And for the most part, that's true. We're able to not only just look into a traditional impression and look down into it, but with these scanners and the images that they're giving us, our preps are blown up to a point that we see everything at different angles. It just makes it a lot easier for us to give good quality impressions. But not only that, if there's some issues with our prepping, we can identify that and make those corrections right away. So for the most part, having real-time access to these scanning images is true. Secondly, scans take less time to create than traditional impressions do. And that's for the most part true. You think about the way we used to take impressions, triple tray, single unit crown, heavy body, light body, bite registration. The amount of time that takes with a digital system, I could scan that same area, make the bite, and send the case to the lab. And that's how fast these things are. So we're talking about the time it takes to scan. It's really faster than traditional impressions are. However, it's a little bit misleading because in a perfect world, those are true. But a lot of times in dentistry, things aren't so perfect. Things happen. And remember, when you have a digital scanner, it is basically a computer and it acts like a computer. For the most part, things work really well, but there are sometimes issues, whether the computer is lagging or the scanner is lagging, which adds to the time. So And that's kind of like something that's usually not talked about when we're talking about scanners. Everybody's talking about how fast they are, the speed of scanning. Yeah, that's one thing, but there's other things to consider when you're making a digital impression. And the other thing in the study is that patients definitely feel that scanning is a lot more comfortable than traditional impressions, where we're loading up a tray with impression material and having them take an impression that way, especially with patients that have very small mouths or have a gag reflex. Digital impressions are very well received by those types of patients because they're able to get an impression done without going through a lot of drama, without the mess and fuss that a traditional impression may give. The labs. When you have a digital impression, they're very, very accurate from the lab standpoint. Also, the labs are experiencing fewer remakes, which means they're saving a lot of money. And the reason why the labs are seeing these fewer remakes and the scans are very accurate is because there are fewer steps involved when you're making a digital impression. Think about when we're making our traditional impression with impression material, we use heavy and light body materials into a triple tray. Material sets up, take a bite, package this all up. It either gets picked up or sent out to another lab. That's another day. It gets to the lab. It has to be poured up. And then it makes it to the bench of the tech, and they're able to see the case. Whereas in digital, there's less room for error because all you're doing is you're scanning, and then that scan is being sent right to the tech, and they get that immediately. Whether they work on it immediately that's not always the case, but the point is they get it's gotten to them very fast and very quickly, so they're able to take a look at it, and more importantly, when things go good, it's fine. They're able to get through the case and have it come back in the time that you want it to come back. But when things don't go right, when there's problems with the case, if there's not enough occlusal clearance, or the prepping isn't very good, or there's not enough soft tissue retraction, the techs can identify these areas immediately so that they can contact you and let you know that something needs to be changed, as opposed to waiting days upon days as we would with traditional impression materials. The other thing that is good about digital impressions is that usually there's some type of live component or live support through the lab, in which, as you're scanning with the patient there, the lab tech can kind of remote into your scans and basically evaluate your scans as you're doing it, so that once you're done, they can look it over and say, hey, this is a good scan, and they can start working on it right away. That's just something that we don't have with traditional impression materials. This is the first time when you have digital scan that the doctor in the lab is on the same page. We both are looking at the same thing at the same time. We have the models, we have the prep, we have the opposing, the bite, everything is articulated. And so again, it usually goes really well, but the biggest thing is, as far as digital is concerned, is that we can catch mistakes, we can catch problems early on, and some of those problems can be corrected easily. And what this does is it cuts down on delays of the case getting back to the office. The other thing that is a good option when you're working with the lab and you have digital impressions is the diagnostic options before the permanent restoration is fabricated. In this particular case, the diagnostic option that I chose to do was a virtual wax up and models. This was a 3-unit bridge that we were replacing tooth numbers 4 through 6. The patient didn't like the position of the premolars 4 and 5, and so they were positioned too lingually. And so, as you can see in the upper left here, this is my preps. This is a diagnostic wax up that was initially created for this bridge. And a couple of things as I look at this picture: A, the premolars are still recessed a little bit lingually, and B, the bigness of this number 6, this canine. And so again, with the virtual wax up, all these things can be changed. Here at the top, you can see the arch version of, or the arch view of this digital wax up. And you can see that teeth numbers 4 and 5 are positioned lingually, then 12 and 13. And so because this wax up was done virtually, I was able to see it after like 5 hours. I did this case in the morning, and by 3 o'clock that afternoon, I had this digital wax up ready to go and to look at it the way I needed to look at it. So I looked at it, I assessed it. It still needed some improvement in terms of moving my premolars out buccally. And so they made another virtual wax up, did that, made the adjustment, made this canine a lot smaller, had a look at it. Once I was satisfied with the second virtual wax up, which I got back in probably the next day, I had them make a physical model of that wax up that was sent to the office. And what that did was it allowed me to kind of see, not just on a computer screen or a laptop screen, but it allowed me to kind of see it with my own eyes in my hand, what this bridge was going to look like, or what this wax up really looked like. And once it got to the office, we had the patient come in. Her and I both looked at the case. We both looked at the bridge. It definitely was an improvement from what she had initially. And so the next step was, once she okayed it and I okayed it, just connected back with the lab, told them to fabricate the permanent restoration in the same shape and form of this model, and we were good to go. Again, the total time on that was probably about a week. Didn't take long at all. And then we got the bridge back shortly after that. So it's a big advantage when you can do these things virtually, because you can see a lot of things, but again, more importantly, you can avoid a lot of problems. Can you imagine if we just went ahead with the permanent restoration with this image of this wax up? The patient wouldn't have been too happy about that. Now I'm going to show you the actual scan of this case. See here my preps. Again, just a digital scan just allows you to see your preps just so differently than traditional impressions do. All different angles. I'm taking away the lower. Now you can see the whole arch, and you can see these premolars are kind of positioned more lingually than 12 and 13. Then I'm going to ask for my virtual wax up. And there it is. And again, this is the initial wax up. Still, these premolars are just not in the right position. We also told them to add some height to these premolars on the buccal. But again, the time that it takes to make this happen was just in no time. And again, it also just saves on the back and forth to the lab, having the patient come back and forth. It's just incredible how the digital world has just kind of changed the way we can do dentistry. The other option, as far as a diagnostic way of doing things before the permanent restoration, would be to ask for a virtual wax up and a provisional restoration. In this case, we're dealing with tooth number 7. I prepped the tooth. Patient was concerned about the size of the tooth, the size of the crown that we're going to be making. There were some space issues with tooth number 10, and she wanted to make sure that whatever we fabricated in the permanent restoration, that it was the same size. Number 7 would be the same size as number 10. And so did the prep, did the scan, and asked for the virtual wax up. Again, this takes about a day for them to get this back to me, looking at the virtual wax up of tooth number 7. When I compared that to tooth number 10, it looks a little bit bigger. They tried to close up this space a little bit more. They made this tooth look a little bit bigger. the good thing about this is that not only am I looking at this and the lab is looking at it, but I can send these images to the patient, which I did email them to the patient so that they can kind of get an idea of what we're looking at in terms of the final restoration. And so before they sent the provisional for this case, I told them to kind of make this wax up of number 7 just a little bit smaller, give me a little bit more space on the distal. And so they did that, and this is what they came up with in terms of the virtual wax up. Now, this virtual wax up was used to fabricate the provisional restoration. Once the provisional restoration came into the office, we had the patient come in, take off her existing temporary, put this temporary onto that prep, had that patient wear the temporary for about 3 to 4 days, just to get some idea of how it felt, how she liked it. She liked it, the color was fine. The one thing she didn't like was this lingual bump on this crown. And so again, the fact that this was a temporary restoration, and we were able to modify this temporary to her satisfaction by just taking a burr and just kind of smoothing this out to make it better for her. And so at that point, once we did that, we took another scan of the modified temporary that's already on number 7, scanned that, sent that back to the lab. And from that, they were able to fabricate the permanent restoration. And so again, saving time and saving money, not having to remake permanent restorations over and over again. That's the advantage of going digital. Now, this is the scan of that case. Tooth number 7 here. Again, just being able to see your preps is just very nice when you go digital. And then the wax up. Makes it a lot easier when you're able to do a digital wax up and just move those images, not just for you to see, but the patients to see so they can be engaged in the process as well. This is the wax up. Again, based off this wax up, a temporary was made, made the adjustments on the lingual, and then did a new scan to fabricate the permanent restoration. So my experiences with scanners. Before 2013, I was taking traditional impressions and didn't have any problems, was fine with it. But in 2013, I was able to get a digital scanner. Now, the scanner that I got was a 3M COS. This particular scanner was a powder-based scanner. Most of the scanners now are not powder-based, they're just basically video cameras shooting your preps. But at that time, you had powder-based digital scanning systems. And what that meant was that you had to really do a good job of not only soft tissue management, but also keeping the field dry. Because when the powder hit your prep, if it was wet, it would just simply turn to mud and just clog up the image that you were getting. Your preps wouldn't look so great. And it was a real challenge when we had those systems because it was like you had to put enough powder on there to capture the scan. If you put too much, it kind of distorted what you were trying to capture. But if you didn't put enough, it wouldn't scan. So the learning curve with those systems was a lot larger or higher than they are today with today's scanners. So at that time, 2013, I probably used that scanner for about 2 years. And during that time, I probably got to about 40% digital scanning to 60% traditional impression. So I was still doing both at the time. In 2015, 3M discontinued this product and discontinued the support to this product. And so we switched back to traditional PVS impressions. And it wasn't until recently, last year, 2021, that I got back into the digital impression systems. I currently have a scanner now that I use, and I'm happy with it. It's definitely better than the powdered system that I used with the 3M model. The one that I have now is powderless, and it works very well. Now, as I mentioned, back in 2013, 2015, I probably was 40% digital and 60% traditional. Now, after using the scanner that I have for about almost a year, I'm at 60% digital and 40% traditional impression materials. And when I make a traditional impression, I usually use this Catapult Penicil impression material. It's a PVS material. It's highly hydrophilic. So I use a one-step impression technique, meaning I use a heavy body on the prep. Heavy body in the triple tray, light body on the prep to make my impression. And then I use a separate bite registration for the bite. Also, this heavy and light body material come in 50 ml cartridges with the auto mixing tips, and they come in also with the jumbo size canisters. Now, the thing about this company, Catapult, is that their impression materials highly tear resistant, have a consistent set time, and do a good job, especially the light body, of capturing detail in the impressions. So that's why I like to use this material. I also like to use their bite registration material, which is Futar. It comes out, it dispenses very, very easily, but it sets up firm and rigid. It gives an excellent bite when I use it. I also use this material because it sets up so fast. I also use it for the temp matrix, especially when I'm doing a single unit restoration. Another product that they have is Silginate. It's a alginate substitute that also does a good job of picking up a lot of detail, especially when I'm using it to make the temporary matrix. The other thing about this company, it sells direct. So all of their products are definitely at a lower cost than anything that you're using. I highly recommend these impression materials along with the bite registration and alginate substitute Silginate. Now, as far as the scanner, I have a Trios 3 wired scanner. They recently came out with the updated wireless scanner, their Trios 5. Both are equally great. The biggest thing, or the biggest difference between the wireless and the wire, is that with the wire one, you have a direct connection with the laptop, your laptop, and the scanner. Whereas with the wireless one, the connection is wireless, which means that it could be some static or some delay in your scanning process. So for me, I like the hardwired scanner. And as they go and as scanners get better, I'm sure the wireless ones will be just as good. But for now, the wired one is the one I use. Definitely the workflow with digital scanners is definitely a lot easier than traditional impressions that we take. Not only is it easier, but it just takes a lot of the stress out of trying to make the perfect impression with traditional materials. With the workflow with digital impressions, the biggest thing is if something goes wrong, it can be fixed right away, especially if you're not soft tissue retracting enough. You can't see some of the margins. Right now, labs they probably get in more than 50% of the cases that they get have margins that aren't readable. And so with this, when you have margins that you can't read or you can't see and you get a bad impression, fixing it and changing it is very quick and easy, and it definitely saves time and money. The other thing about having a digital scanner is that you're able to keep track of things. Taking an impression with a traditional impression material means that take the impression, packaging it up, sending it out. We have to keep track of when we sent it, who we sent it to. With the digital system, all that's done. You're putting in the patient's information, you're putting in what you want, the shade, all that is kept track within that particular digital system so that you know what's going out, when it went out, when it's coming back, and more importantly, if there are any kind of delays on the lab ends, you know immediately because they're letting you know that as it happens. Now, whether you're going digital or still doing traditional impressions, with both of these things, you have to soft tissue manage. You have to. It's like this is the biggest thing with digital. If you're not used to soft tissue managing, meaning packing cord or any other way that you're retracting soft tissue, or you don't do it at all, maybe digital isn't for you, because with these new digital systems, it's a must. There's no way that you could kind of do these type of cases with a digital system without proper soft tissue management. I know a lot of times, even when I'm dealing with a single tooth that's been root canal, and I'm saying to myself before I start the case, okay, I'm going to stay sub G. I won't have to retract. And ultimately, that doesn't happen. And so you just have to keep this in mind that if you're not going to retract or you don't like to retract, then this type of system isn't going to work for you. So because it's that important, I'm going to go over a couple of things, or at least a couple of options in terms of soft tissue management and retracting soft tissue. And the first and the most common is retraction cords. Typically, when I do use this technique, it's a 2-cord technique, placing the thinner cord around the prep first. And then on top of that, placing a thicker cord, allowing that to stay for 2 to 3 minutes. And then removing the top cord and then taking an impression from there. And what that does is allows the soft tissue to be retracted off the margin so that you have a clear vision of all the entire margin. Now, packing cord can be traumatic to the soft tissue, does take a lot of time, but it works every time, especially in difficult situations where you have very deep margins or you have very thick soft tissue that may be overhanging onto your margins, or in the opposite, where you have tight, thin soft tissue that you have to push off your margin. So in difficult situations, I revert back to retraction cords technique. Now, another option would be to use retraction paste and caps. Now, this system where you have retraction paste that's going to be placed around your margins, and then having a cap placed over top of that and having a patient bite down for 2 to 3 minutes. This system, less traumatic to the soft tissue, very quick and easy to use, and works in most situations. I probably 90% of the time I'm using this particular type of soft tissue management or soft tissue retraction, the retraction paste and caps. The other 10% I'm packing cord. Now, this particular product that I like to use, the Voco retraction paste, a couple of things that I like about it. One, the aluminum chloride base allows the sulcus to be very clean and very dry once it's rinsed off the prep. Number 2 is the tip. The tip is bendable. You can bend it in different angles to allow you to place it on your margins. Also, the tip has a hole that's kind of medium sized. It's not too small where you're getting a thin amount of material out of the tip. It's more of like a medium sized rope to allow, it gives you body to allow the retraction of the soft tissue. Another thing that I like about this tip is that it's very short and it doesn't waste a lot of material. This material, one of the biggest things about it is its color. Now, because it's a turquoise bright blue, you can't miss it. So when it's on your prep and you're ready to remove it and you're rinsing it off, you can really, really see it, because you want to make sure that whatever paste you're using, whether it's this or another product, you want to make sure that your prep is clean of that retraction paste. And with this, you can very easily see, as you can see in this picture here, the bright blueness of this paste. It's easy to be seen and it's easy to wash off. Now, going over some cons of digital scanners, because we all heard the hype of everybody's doing it. The numbers are going up in terms of how many scans are being done, but there are some drawbacks when you have digital scanners. And these are some of them. One of them is still the high cost. And even though the cost is coming down and it continues to come down, the range now is anywhere between 15 to 50,000. And as more people use them, that price will come down, but it's still high. And so that's a deterrent to some people going into the digital scanning, getting a digital scanner. The training and learning curve of digital scanning. Now, there is usually around 3 to 4 hour training that goes with any type of digital system. And the learning curve, it's not that bad. I would say it's probably about a week or 2 weeks of using the scanner, getting used to the scanning. Remember, you don't have to get a scanner and just go right into using on patients. You can use models that you can practice scanning on, which makes the learning curve a lot less if you do that. I highly recommend that because it just makes the transition a lot easier, not just for you, but also your staff in terms of how the workflow is going to go. Also, with the digital scanners, you must have a reliable internet connection. I mean, these scanners rely on not only the internet connection, but most of the time the laptops or the computer system that's coming along with the digital scanner. Remember, it's the scanner, the laptop, the internet, and the lab. And all that whole connection has to be solid and has to be together. Any kind of break or any kind of loss of connectivity in that chain means that you're going to have a delay in your scanning. So you have to have a strong Wi-Fi or internet connection when you're considering getting a digital system. Some other cons for a digital scanner. We talked about this earlier. It takes longer to use a scanner in terms of the setup time, but the actual scan time is less than traditional impressions. So what I mean by setup time, in terms of putting patient information in, deciding on what you want, ordering what you want in terms of crowns, bridges. It also, there's also can be delays in terms of just the way the scanner is scanning. And that's why it's important to have a good, strong internet connection and also an updated laptop. Usually with digital scanners, they come with a particular laptop and they're usually to the specs that the scanner is going to be compatible with. But you just got to remember that just because you're using a scanner, it's not always going to be the fastest option. The other thing about digital scanners is that it doesn't work for every case. And that's why, as I mentioned, right now, I'm probably 60% digital and 40% traditional impressions, because it just doesn't work for every case, whether it's soft tissue that's covering the margins, whether it's usually the tip size. The tip size for these scanners can be kind of big. And so sometimes, especially with patients with very small mouths or can't open very wide, it's hard to get back in the posterior area with these scanners or get the right angulation to scan your prep. So you have to keep that in mind with these digital scanners, is that you can't say that, okay, I'm going to go digital and I'm not going to do any traditional impressions. That's just never going to be the case. At least right now, it's not the case. I'm sure as time goes on, as we get to smaller tips and better scanners, we'll get to that point, but we're not there yet. Now, let's go over some of the pros for digital scanners. One is that when you get a digital scanner, they're always improving, whether it be the software or the scanner itself. It's a thing that, especially with the software, at least the scanner that I have, there's usually updates that are occurring every 1 to 2 weeks, so that making it better, making it faster, allowing the scanner to be calibrated in a way that it's going to be more consistent in how it's being used, to cut out some of the buffering or the lagging of your computer. So that's one thing about the digital systems, is that they're always improving, they're always getting better. Number two is you're leaving out the mess of impression materials when you go to digital. That's not anything that anybody's going to miss. Also, this doesn't happen that often, but it does. And then sometimes it kind of impedes on work that needs to be done. I'll have patients that, for whatever reason, we may need an immediate denture where we're taking out teeth, especially in the aesthetic zone in the anterior, and those teeth are in bad shape and they're very loose and mobile. And a lot of times patients don't go through with treatment because they feel that if they have impressions, that those teeth are going to be taken out with the impression, or an old bridge that, again, is in the front may come out with the impression. Here is a picture of a case that I had just 2 days ago, where this is tooth number 13, and they had a crack kind of down the middle of this tooth. Now, this was a non-restorable tooth, and we're going to have to do an extraction on it. In the meantime, the patient wanted something there the day that we take it out. So we did a scan. And before I did the scan, in this case, I was able to use some flowable composite, kind of bond this together to allow the tooth to stay together, and then scan this tooth. Now, had this been traditional impression material, I probably kind of would have treated it the same way, trying to kind of give it some material in that crack to kind of keep it together while we took a traditional impression, so that it has a better chance of kind of staying in the mouth. Because sometimes if I don't kind of, reinforce this crack with a traditional impression, it could kind of pull this whole half of the tooth out and come out in the impression itself. So that's one of the things that that's good for traditional, or good for the scanner, because it allows you to scan and make impressions without disturbing the teeth that are maybe compromised. And then the fourth thing would be patient engagement. With the scanner, your patient is able to see things like you're able to see things. You're able to show them their whole entire mouth. You can show them how things are breaking down. You can show them how cavities are forming underneath their restorations and why they need to be replaced. That's the good thing about digital scanning, is that it brings the patients more awareness of what's going on in their mouth, because they can actually see it. Also, it gives you credibility of staying up on new technology, new procedures. So when you have a digital scanner, patients look at that as that they feel like, okay, you're doing your job in terms of trying to inform the patient of what's going on and trying to stay up to date on current technologies within dentistry. Some other pros, that really is like the best thing about digital scanning is that the turnaround is incredible. I can't recall when this didn't happen, and where the case is out and being worked on at the lab before the patient leaves. I mean, that's how efficient the workflow for digital scanners are. And that's where the speed comes in. Yeah, a lot of, when you going and you're looking at different digital systems, they're all going to talk about the speed of scanning, and that's good. But the best thing is not just the speed of the scanning, but the speed of the workflow that happens when you go digital. I mean, basically you're scanning and then it's to the lab, and there's no middleman, there's no time lapse. It's there, and they start working on the case. And a lot of time, by the time the patient comes out, has their temp, that case is like, it's almost done. And so in terms of a single unit crown, I typically get that back within 3 to 4 days. It's just that quick. And that's one of the best benefits of going digital. Another thing about digital impressions with digital scanners is that it kind of resets our ability to assess our occlusal clearance. Now, everybody wants to achieve at least 2 millimeters of clearance when we're doing crown and bridge cases. But our judgment isn't always the best. And so there are ways or things that we can kind of make that a little bit better by either using occlusal tabs or measuring out with a probe. But for the most part, when we're looking at our preps and we're trying to decide on how much clearance that we have, it's not always ideal. However, when you're using a digital system, there's no guessing, there's no, I'm not sure. It's just an automatic thing that once you scan, you know exactly how much clearance you have. And so as you know, so will the lab knows. And so in this case, I've done crowns on number 18 and 19. This is my buccal view. So I'm kind of looking at this straight on, and it looks like I'm okay. But the problem is that I'm not okay. I can't see the lingual. And so when you have a digital system, you're able not only to see the buccal aspect of your prep, but also the lingual aspects. And with this heat map that kind of gauges how much clearance you have, red being no clearance, and this light green being 2 millimeters or more, you can see I have these red areas. That means that I don't have enough occlusal clearance for this particular case. And not only is it showing me that I don't, or telling me that I don't have enough occlusal clearance, it's also showing me exactly where it is, so that when I go back, did my scan, I get this heat map that tells me, okay, I don't have enough occlusal clearance. While the patient is there, I can take my burr and go exactly to the spot that's showing me that there's not enough clearance, do my reduction, and take a new scan, and then be good. That's something that would take forever if we had to do that with the traditional impression. This is another example of kind of assessing your occlusal clearance. In this case, this is tooth number 19. I prepped this tooth, patient still in chair. We scanned them. This is the heat map that came out. Now for me, I like to have at least 2 millimeters of clearance for my cases. And in this case, I'm probably at 1.75. And so what did I do? I saw that I'm kind of short. I'm not at 2 millimeters. I know exactly where my clearance is. I took a high-speed burr, diamond, kind of cut that back, reduced it a little bit more, and then rescan. And this is what you see on the right, where there's no color, which means that I have 2 millimeters plus of clearance in this particular case. Again, it's quick, it's easy, it's very, very direct and precise in terms of your digital scanners. Allows you to do things in a way that you just really can't do with traditional impressions. Now, the other thing that digital scanners allow you to do is when there are mistakes, where are things that you have to retake a scan or remake a scan. It's very quick, it's very easy. If we imagine that this is an area that didn't have a good scan or we didn't do a good job of soft tissue reflection, once we do the scan, it's a matter of identifying that area, cutting it out, and then rescanning. Takes seconds, and then we have a whole impression, digital impression to be sent out. That's corrected right there, right then and there, while the patient's still in the chair. This is an example of what happens if you have an area that needs to be rescanned. We're saying that that area needs to be rescanned, kind of cut it out. Now you're going to see the scan. It's just going to be just seconds. It just goes over that area with the scanner, and then that's it. It's done. And that's my new scan. And the beauty about this is not only is it done very quickly, it's done very precisely so that that new part that you just scanned gets incorporated with the rest of the scan. You don't have to scan any other places around the whole margin again. You just scan that area that was defective, and then it's back to a whole scan. The other thing that digital scanning allows us to do is reassess the way we prep. Basically, it makes you a better prepper because you're seeing your preps in a different way. Typically in traditional impression, we don't really see our preps. We see our preps, we take the impression is sent out, it's poured up at the lab. The only time we see it is when it comes back. And so in this way, when it's digital, we see our preps blown up and instantly, so that if there's some issues in terms of flattening out the floor of our margins, smoothing off our axial walls, or redefining our preps to cut out any undercutting, we can do that in real time, right then and there, and then make another scan to make a good impression. And in that sense, we're able to send a good impression to the lab, and they're able to create a good restoration that's going to fit accurately to our margins and be durable over a longer period of time. So the other question, now I know I haven't forgotten about the initial question, but the other question of the night would be, okay, where do I start if I want to go digital? And so the first place you want to do is do some research on the scanners. The second is you want to demo some scanners. And then the third is you want to secure the money because they do cost. So the research, I would first start with your local Crown and Bridge lab. I'm sure they get a lot of scans. They know which scans are good, which scans are not good. They can guide you in terms of what they prefer, because if you're going to be sending cases to them, they can give you some insight on the scanners that work well with them in their lab. The other thing is to look at some comparison charts. Now, you can get these anywhere on the internet, but they're good to look at. They typically have the more popular scanners and give you just a breakdown of how they compare to each other. Some of the things that you should look for are the size of the tips, which matter. The scanning files that the scanner puts out, a lot of times, most of the time, they're STL files, but there are also PLY files. And depending on where you're going to be sending these scans, you want to make sure that it's going to be compatible to the lab that's going to receive them. You want to make sure the files that you're sending is going to be compatible to that lab. Also, you want to know how to clean or disinfect these scanners. And then if there's any kind of warranty involved, and also the cost. Another website that you can go to that gives good evaluation of scanners is Dental Product Shoppers. If you go to their website, hit product categories, and then hit digital impressions, you get a review of, again, the popular scanners. It's just a lot of good information on this website. The other thing too is, if at the end of this webinar, I will have my email address. And if you want any parts or this whole presentation, you can always reach out to me, email me, and I can give you this in a PDF form. Another website, Universal Dent. This is a supply company that specializes in dental imaging, and they do a really good job of breaking down all the scanners that are on the market. If you go to their website, hit blog, and you come up with these two categories, the intraoral scanner comparison, where they compare all the scanners. And then also there's an article on how you can integrate digital into your practice. And then the last one is intraoralscanners.com. Again, they just give you a lot of good information, not only about the scanners, they also go over the numbers in terms of how to compare digital and traditional impression. In this case, one of the numbers that I like to look at is the total cost of impression. So with conventional traditional impressions, they run around $38 to $40 in terms of the cost to make an impression, as opposed to a digital impression, which is about $20. So that's a big difference, especially if you have to remake or redo an impression, whereas you're at possibly $80 to redo or replace a traditional impression, as opposed to remaking a digital impression, which doesn't cost anything. You're still at the same $20. So that's a big difference. So again, this website gives you a lot of good information on those scanners. The other thing you want to do is make sure you want to demo several scanners. Have the comparison between the wireless and wired scanners. Make sure that you know how to import photos, depending on how you're taking your photos, whether it be by your phone or through an intraoral camera. You want to make sure that whatever the scanner that you get is going to be easily receiving your photos. And then again, the tip size is very, very important. And then the port, I'm having a scanner that's very portable. Most of them have this kind of unit with the computer inside and the keyboard kind of surface with this monitor. I like the laptop version where you can just move this laptop from room to room and be able to scan. Also, in terms of communicating with the lab, it's easier when you have a laptop because you're just typing in the information or typing in your request of what you want for your particular cases. So those are the things to consider when you're considering a digital scanner. And then the last thing, just making sure that you get the monies to get the scanners. But hopefully, again, as time goes on, the price of these scanners will go down and make it affordable for everybody to have one. So going back to the original question, why do you need a scanner? Okay, you need a scanner because it delivers better and more consistent dentistry. It also makes us efficient in terms of how we're working in our workflow. And the last thing is the patient engagement. It allows the patients to be a part of the process. You know, we take for granted that, okay, we're just going in there doing the work and there's a patient attached to this. And when you have their buy-in and you have them being a part of that process, it's a good thing. And it encourages them not only to go through the treatment that you want them to go through, but also on the back end, trying to be more proactive and kind of taking better care of their teeth. And that's ultimately what we want. That's all I have today. This is my email address. If you have any questions or want more information on digital scanners, you can always shoot me an email and I'll be happy to respond back. So any questions? One of the questions are you storing the scanner data locally on your server or in the cloud? It depends. So the question is, where do you store your scans? It depends on the digital system that you're getting. Some systems have you store them, within your own system or on the cloud, or some systems the lab stores them. So it just depends. I would prefer the lab storing them or having access to them through the lab, because it frees up us having to store them somewhere. So with that, in terms of the digital system, they either come with a laptop to the specs for that scanner. Most of them do. So it's not a situation where you have to like purchase a separate laptop by itself and then your scanner comes with it. It's usually all together, all one. I don't recall it being done another way. My only thing is I'd rather prefer that laptop and scanner kind of setup as opposed to one that has it kind of all in one, where you have the monitor, the CPU, the computer, and then you have the scanner, and where you have like kind of like a keyboard that's kind of on that kind of in that kind of system. That doesn't really that doesn't lend itself really good to, like I said, communicating with the lab and any kind of typing that you have to do. So the question is, which digital products do you pay for? Virtual wax up, the data storage, or final crown? So it just depends on the lab and how they do it in terms of what you have to pay for. But typically, if I'm scanning for a single unit crown, there may be a slight fee for a wax up. It just depends. It just depends on the lab and what their fees are. But generally, it's not that much. It's definitely a lot cheaper than if I would order a traditional wax up on a traditional impression. I'm sure that's going to be a lot more than it would be on a virtual wax up. One of the questions, how do you send the scans to a lab? Typically, depending on the system that you have, there's a direct connection from your scanner to the lab through whether it's a portal or somehow they remote into your scanner, but that's usually the connection. And then depending on the digital scanner that you get will kind of dictate that. Do you scan for aligners? Do you use the same scanner for crown and bridge? So the question is, do I use the same scanner for crown and bridge that I would do for aligners? Yes, you can. I mean, that's another benefit of scanning. You can use it for multiple things. It just, again, depends on the lab that you use. Some labs have that capability of doing aligners and crown and bridge. And when they do, you're more than welcome to kind of use that. And it's just a benefit of keeping everything in one lab and being consistent on where you're sending your files. Would you do digital wax up on your Trio scanner? I think I answered, yeah. So the digital wax ups that I was showing you was on the Trio scanner. So the question, can you use the scanner for full denture? And the answer is yes. Most scanning systems have some type of capability where you're scanning or making a digital denture. Typically, the steps are a lot less, usually anywhere between 2 to 3 steps in terms of creating a digital denture. But yes, it can be used to scan dentures and partials, along with implants as well. It's usually some type of scan body that's going to be placed over top of the implant that you scan, and allows a lab to fabricate a crown or bridge over that implant. So there's another question. Does more scans mean more cost for data? Sometimes it does. Again, it depends on the digital system that you get. Some pay, or some have you pay like an upfront fee for however many scans that they want you to scan for. Let's say it's $100 for 200 scans. It just depends on what they set up or how the setup is. So yeah, the digital wax up is on the Trios. And how it's done is, it's just a matter of, once the scan is done, you ask the lab to create the digital or the virtual wax up, as opposed to creating the final restoration. And they will do that. And you have access to that. You can look it over. Like I said, you can email to the patient. And then the examples I gave you, Once I had that done, I still wasn't sure. I had a model made of that virtual wax up. Or you can have a provisional made off of that virtual wax up before you get to the permanent restoration stage. Where my office is located, my office is located in Maryland, Mitchellville, Maryland. The name of the practice is Wilmore Dental Center. So the question is, do you need a technician in your clinic or your office to do adjustments or operate the digital system timely? No, the learning curve is not that great. I would say a week or two of practice scanning is good enough. Typically, with the scanners, the training can be done remotely, or they can send somebody, a rep in, to kind of guide you through that process once you get the scanner physically in your office. But it's definitely not a situation where you need to be handheld through that process. You get the training, you practice on models, and then the next step would be probably practice on your staff members in order for them to kind of get comfortable in scanning, not just you, but also them scanning. And then that's it. And as I mentioned before, most of them have some type of live chat, so that when you are scanning, whether you're practicing or you're with a patient, they can kind of remote into your scan and see what you're doing and kind of talk you through that without physically being in the office. This other question, your opinion on Korean scanners. I'm not too familiar with the Korean scanners, but my advice would be, if you're interested in any particular type of scanner, is kind of do your research, read up on them, get some information, and talk to the reps about them. Definitely demoing scanners is very helpful in trying to make the decision on which scanner to get. So with that, the question is, do you have to pay extra for apps on a scanner to do implants and aligners? I don't think so. Most scanners have that capability of just scanning and have some type of program within itself to do either aligners or have some type of scan bodies that they fabricate to send to you that are scanned over top of those implants, so that you can get so that you can restore implants. So it's not, I don't think it's anything separate in terms of an app, and I don't think it's anything extra. It's just that, okay, this is what it's going to cost to restore this implant, or this is what it's going to cost for these set of aligners. It's not a separate cost in terms of the app or another application separate from what you do for Crown and Bridge. Well, thank you guys.